Hello, this is Nina Waxman from No Rare. I'm the founder of No Rare, and I have the privilege to have a discussion with Ariana Barton, who is a somebody who has been diagnosed with IgA nephropathy, otherwise known as IgAN, which is a rare autoimmune kidney disease. And like many of us who've been diagnosed with a rare condition, it's been a journey and a learning experience. And there's often not a established playbook of like in other conditions that are more well known about what to do. And not only is there not a established playbook, it's often hard to find a doctor or a specialist that actually knows about these diseases. So one of the goals of these discussions is to share some of the key learnings because the only way you learn in rare disease is by experience. And we wanted to tap into Ariana's experience. And perhaps somebody here watching this will take away something that could help them in their journey. So with that, I'm going to ask Ariana to give us a little background about how she was diagnosed, when she was diagnosed, how her journey went to where she is today, and especially about, how she came to really be such an advocate for herself and for others with IgAN. So with that, I'm going to ask Ariana to talk about herself a little bit.
Hi, I'm Ariana. I was born and raised in Houston, Texas, and still live there to this day. So I'm very close to the Texas Medical Center, where I'm supposed to be able to receive the very best medical care in the US, if not the world. But unfortunately, dealing with rare disease, that was not the case for me. So, kind of backtracking, I started having symptoms, which for IgA nephropathy, was dark and foamy urine and lower back pain. That started in around February of 2022. And I tried to ignore it for a couple of weeks, but eventually it became too much. So I had to go to my primary care doctor. She was thankfully very receptive and ordered a bunch of tests. So we found out through those tests that I was spilling protein and blood in my urine, which was very concerning. So she immediately referred me to a nephrologist. Unfortunately, the wait time to get in to see a nephrologist was about 2 months. So
Wow.
between February and April, I was still experiencing symptoms, but not able to actually do anything about it, ask any questions to anyone who would know anything about the kidneys. I mean, my primary care doctor was amazing, but there's a reason she referred me to a specialist. So
Mhm.
um, that time of 2 months, it felt like forever. It was agonizing just waiting to get in and see a nephrologist. So I was doing my own research, which they tell you not to do. But I couldn't help myself. So I was online looking up all my symptoms, trying to figure out what was going on. And everything was textbook IgA nephropathy. So whenever I went to my first visit with the nephrologist, I was so ready to hit the ground running and just I knew what was wrong. So at the end of our visit, I mustered up all of my courage and I said, I've been reading and I kind of think I might have this rare disease called IgA nephropathy. And he laughed and said, that only affects white and Asian men. And you are so young. There's no way that that's what you're dealing with. We just need to rule out a chronic UTI. So I had already started antibiotics with my primary care because that was the first thing that she thought of too when there was blood in my urine. So we addressed that. And of course, the antibiotics didn't do anything, which I told him that. And I said, listen, I already took antibiotics, nothing improved. I'm kind of ready to take the next step. And he said, let's just do it one more time. And I said, okay. I trusted him. And then under his care, I did 2 more rounds of antibiotics, so 3 in total. Those antibiotics all had a warning label on the box that said, don't take if you have kidney problems. So unfortunately, throughout the time that I was seeing him, I was getting my labs done probably every 2 or 3 weeks. We weren't getting any closer to finding answers. I was getting really nervous, really antsy. I was so scared. Um, And eventually I had to like put my foot down and say, we need to really get to the bottom of this. Nothing is making sense. Like, we need to start doing other things other than just retesting the same things. And he wasn't very like informative or telling me what the results were saying. Like, we never had a discussion about kidney disease. It was just like, yeah, you probably have a chronic UTI. I don't know. And so it was just on and on with the same thing. And so finally, my mom got so angry and convinced me to go and get a second opinion, which I did. So, I was transferring all of my medical paperwork and all my lab results and everything over from one doctor's office to the next nephrologist's office manually. Because unfortunately the first nephrologist office wasn't like on top of it and helping me get my stuff. So I had to request it and manually send it over to the next nephrologist. And so in doing that, I was like, well, I haven't actually looked at my own labs. So I'll do that now. And I went and I looked at what all the numbers meant. And I found out that my GFR, when I first started seeing him back in April, was 70. And then that time, when it was like maybe June or July, my GFR was 34. And he had never mentioned that to me. He never told me that my kidney function was declining. He was just giving me more antibiotics and telling me, we don't know what it is. And so by the time I went to see the second nephrologist, I was very upset. And I asked him what I should do. And he said, you need to get a biopsy. It's been long enough that you've been dealing with these symptoms. Like, we need to really get to the bottom of this. So went ahead and did the biopsy, I think the next week. And then maybe 3 weeks later, I got the pathology results and found out that I was diagnosed with IgA nephropathy.
So you really had to, really advocate for yourself to get the right care. And it sounds like your mother also helped you, spur you on. So I'm just wondering, how did you learn about, EGFR, about your kidney function? Where did you get that information to be able to read your reports? Because I think that's something I know when I look at my reports, I'm not sure what things meant. So how did you learn how did you get smart about some of these things that made you feel more confident to go to the to your to advocate for yourself? So why don't you talk a little bit of how you wised up or how you learned more about enough to advocate for yourself?
So when I was reading my lab results, I didn't know what anything meant. None of it had ever been explained to me. So I had to get online and find the resources that would explain in a way that I would be able to understand. And thankfully, because, well, chronic kidney disease is so prevalent, there really is a lot of patient education. And so I was able to find like the American Kidney Fund website, the NephCure website, and the IgA Nephropathy Foundation website. And they have a lot of really great resources for patients to learn about what stage you're in, what this or that lab result means, and what kind of questions you should be asking based on those results, and then who you should be talking to. Do you need to see a dietitian? Do you need to, talk to a cardiologist maybe, or a urologist, things like that. So those resources were a lifesaver during those times when I wasn't getting the answers that I needed from my actual nephrologist. So having that available really was a blessing, and it helped calm my nerves a lot.
And how did you find your new neurologist? Talk a little bit about how the whole second opinion process is very frightening for a lot of people to do that. And a lot of people are very dependent on their nephrologists. But
Mhm.
so talk to us a little bit about how you went and got the second opinion and, where you searched for it or how did you find information about a doctor?
So I was very fortunate when I was looking for my second opinion. I didn't really have any expectations because I had had such a poor experience with my first nephrologist that I said, at this point, I'll take anyone. So my mom was actually the one who suggested that I go and try to make an appointment at one of the university clinics, where they have like professors and people who are like involved in research and things like that. And so that was a really, really good call on her part. So I ended up calling University of Texas. And so called them and I said, listen, I've been going to a nephrologist for a couple months now. Nothing is happening. I need a second opinion. So at this point, please just put me with the first available. Like, I will come in. If there's a cancellation, just call me. I don't care what time of day, if how far I have to drive, like just put me with anyone. And so I think it was like only maybe 2 or 3 weeks that I had to wait, thankfully. And the nephrologist that I ended up seeing was like super knowledgeable about IgA nephropathy. So I got incredibly, incredibly lucky, and I was so fortunate that it just that's the way that things worked out for me. And so I think if I had had that experience initially, I probably wouldn't have needed a second opinion, but I'm glad that I was able to find a good nephrologist, someone who's knowledgeable about rare disease, like relatively early in my journey.
That's really important that your mother's advice was very sound because she said find people who are doing the research on it because they're going to know the most about these things. And because it's very hard for the average nephrologist to know everything there is to be about a lot of these rare diseases, but the ones who are studying it already are going to be the ones who you really want to get the second opinion from. So it sounds really good, really great. But
Mhm.
you went from being very there was an emotional roller coaster you went through, also going the ups and downs. Can you talk a little bit about of how you started, how you got to a place that it's I think now you sound like you feel more in control of everything. So talk to us about that emotional roller coaster that you went up and down and what contributed for you to finding your sea legs, so to speak, and feeling more confident and be more secure in where you are in managing your condition.
I think the biggest part of like my mental health improving, I can really attribute that to connecting with other patients. I think that was like the big change and the big shift for me. So it was really isolating, especially before I got my diagnosis. I think that was the worst part of my life so far. It was horrifying having something that is slowly killing you, but not being able to put a name to it and not knowing what treatment to start. Like, I didn't know what was going on or how to deal with it. So that was the hardest part. Once I got my diagnosis, things definitely got a lot easier. One of the very first things I did was connect with a support group through the IgA Nephropathy Foundation. And because of the IgA Nephropathy Foundation was I met, other patients and I was able to connect with other patients and I met people who were on dialysis and who were post-transplant or post their second or third transplant and were still traveling and working and living their lives. And so that really changed my perspective about living with a chronic illness, something that has no cure, something that's never going to go away, is that like as humans, we're really tough and we can adapt to these things. And, you just kind of learn to live with it and you just go on with your life. Like it changes your life, but it doesn't, like your life isn't over. So that was really like a big perspective shift for me. And I'm very, very grateful that I had that.
The other thing is, I have a grandson who's born with a rare disease, and my daughter does not want it publicly known. So she doesn't talk about it. She doesn't talk about it to him. His friends don't know. There are a few people who also have children with rare diseases that she talks to about it. So I'm just wondering, by doing what you have been, where you have a Instagram presence and you're posting a lot. How did you get like the guts, so to speak, to come out? Like, did you start being very quiet about it, or did you tell people? How did you be more public, get to be more public about what your condition?
I think I'm someone who's always been very open and honest about everything that I go through in my life, and I think, my mind state when I was going through everything was kind of like the squeaky wheel gets the grease, and so I've gotta be loud about this and let other people know what's going on because you never know who would be, like, willing to help or lend advice or, so I was always very open in the hopes that it would help someone else, but then also that it would help me selfishly because, like, I think, sharing my experience has been therapeutic and healing, and I think that that's, um, really powerful when you're going through something is to just be open about it and, um not isolate yourself and not, be secretive. Like it's nothing to be ashamed of.
Do you get people DMing you ever from your Instagram who wanna contact you just to share things or just to tell you, "Oh, yeah, I know what you're going through." Do you ever have that?
I do. I get Instagram and TikTok DMs pretty regularly, and a lot of times it's from newly diagnosed patients who say that they came across my page and that they're grateful for me sharing and it gives them hope and things like that. So it's always really nice to hear that because I think that's what helped me too, and so if I can be that for someone else, then that's the whole point. I love that.
Yeah, that's great. I know I my grandson's condition is very rare, and when you look it up in the medical literature, if you ever try to look it up, there is, like, very different description of symptoms, and then when we started No Rare, we found 2 people wrote into me from one from New Zealand and one from UK, and they have children, 2 mothers, that have the exact same symptoms as my grandson. So that
Wow.
was interesting because here you now they have 150 cases in the world, and we just found 3 that have the exact same
Wow.
manifestations that isn't captured in the medical literature. So I think that's really great when you have that feedback from other people. Do you collect, any information? Do you keep a record or a track record or a journal of what your journey or what you're going through?
Yeah, I write like a couple of sentences a day in a journal, and I do a lot of symptom tracking in there just to kind of keep tabs on where I'm at. And thankfully, everything for the past couple of years has been stable or improving. So it's nice to be able to look back on how crummy I was feeling a couple years ago and compare that to now and have something to like be grateful for.
That's great. Now I'm going to ask you about, have you looked at research? I know you looked at symptoms and you looked at management and treatment. I assume you've looked at treatments. Have you
Mhm.
looked at researchers? Because that's one of the keys to finding a good, specialist in your condition. Have you looked
Mhm.
at research, or what is your attitude about research? Or if somebody asks you about research, what do you say? So talk to us a little bit about research in
So, in terms of research with IgAN, I know there's a lot of ongoing clinical trials, and I personally don't participate in any. I'm not opposed to it. But I know that that's something that's incredibly important for future patients because we won't continue to get more treatments approved if people don't participate in these clinical trials. And so, as a rare disease patient, any research that's happening about our condition is truly a blessing because a lot of rare diseases don't have this. And so there's a huge spotlight on IgAN right now, and I couldn't feel more lucky or more blessed that that's happening. As a patient, it is really, really comforting, and it just feels nice to know that people care and we're not alone and there's people actively working on trying to find a cure or better treatments for this.
Now, one of the things that we find, and I'm wondering your opinion, like a lot of people don't want to participate in a clinical trial because if you've gotten to a place where your meds are working for you, you don't want to kind of upset the apple cart. Is that one of the reasons that you would not consider? participating in what we call an interventional study where they're giving you a drug to test. But would do you think people would who don't want to do that, would they also consider participating in what we call an observational study, which is really just more like what you're doing, where you're recording your symptoms and you're journaling, and that to get more insight into the condition? Because as we said, in rare diseases, there's not enough information about these conditions in general. So do you think there's a difference, at least for you or for other people, in participating in a study where you're getting a drug or you have to go off your existing drug versus a study where you can do what you're doing, but you just are recording what you're going through?
Yeah, I think there's a huge difference between an observational study and like an actual clinical trial with taking a drug. And I think clinical trials are super intimidating for patients, especially if your condition is already, you're not doing so good and you're like on that cusp of almost being in total kidney failure. It can be very scary. And that's where I was when I was diagnosed. And um clinical trials were offered to me as a potential treatment, because when I was diagnosed, there weren't as many treatment options as there are now. And I did consider it, but ultimately made the decision not to because it was scary. It was scary. And, there's kind of this feeling of, am I a guinea pig? Could I r- get an adverse reaction? Like, is this something that is going to harm me more than help me? But ultimately, like, people need to participate. I was just maybe too chicken, but I think an observational study is definitely something that everyone should participate in. So I am in some observational studies, and I share my medical data with researchers. I think that's something that's incredibly important that every patient should be doing. If you have a rare disease, that you should be like automatically opted into that, in my opinion. I think any amount of information, especially if it's anonymized, that can help researchers and help future patients. I think it's selfish not to share what you can. And anonymized data, no one should have an issue or any qualms about sharing that.
Yeah, that's great. Um, and I know people have, you know, sometimes people have no choice and feel that they want to participate because they don't have any options other than that,
Mhm.
which is what happened to some of my family members. And it's more common, you hear that in cancer, for example, people are
Yeah.
more open to participating. But I also think that people don't really know. I think it's also the way the trials are presented to you, because you have to get the information all up front for you. So again, I think one of the things you have to do, and like you said, maybe when you're newly diagnosed, you're not in that space yet, but there are a
Yeah.
lot of questions you would have probably if you were going to do it today that would be a bit been different then, that you know what questions to ask, which a lot of
Right.
times you don't know what questions to ask. So, thinking about what you could share, like what are some of the key takeaways of your experience that, in general, not just on research, but in general, that you would love people out there to know, if you could give advice to anybody else who's starting into this journey as well?
I think my biggest piece of advice would be that dealing with a rare disease is all about mindset. And that goes for anything in life, but it's all about mindset. If you want to be miserable and, drag your feet and just be moping about it and complaining about it, like, you're definitely going to feel worse. But if you try to approach every day in the best way and just give yourself grace and try to adapt, as best as you can, and power through, like, stay optimistic, that really changes everything. It's easy to be down in the dumps. It's a bit more challenging to stay positive, but it ultimately is a decision that you make every single day. And I think that once you realize and accept that, it's easier every day to kind of stay positive and make the right choices, regarding your disease.
I have one more question that really relates to IgA nephropathy and a lot of other rare kidneys, is that a lot of times, most of the time, you don't have symptoms, right? You're not
Mhm.
really conscious on a day-to-day basis of how you're doing. Um, So how does that feel? Or I guess, do you look forward to those lab when you get your labs or when you go to your doctor's visit because you know that that's kind of going to be your moment of truth? Tell me a little bit about how you, like you said, about getting through day to day without knowing how you're doing day to day. How do you deal with that?
Yeah, it's funny because some days I feel really, really great, and then some days I feel really crummy, and some days when I'm feeling really great, I like my ankles will be swollen. And some days when I'm not feeling good, like I have no inflammation. So it's just like you never know what you're gonna get. It's completely a mixed bag and every day is different. And it is hard to keep track of how you're doing without the labs. So my nephrologist orders mine every 3 months. And I they're a little different every time, but more or less stable, and so that just gives me peace of mind, like, having the actual data, because, I can't rely on my body to tell me the truth about how I'm doing and how I'm feeling.
So you actually look at your labs when they come in so you can see yourself. You don't even need actually, I mean, you're going to go to the doctor too, but you can also see from your labs yourself. You've learned enough by now to know how you're doing from looking at your labs, right?
Yes, it definitely took a long time for me to learn what all the numbers meant and, how that applied to my disease. But once I figured it out and kind of got a hang of it, which honestly took about a year, now I can look at my labs that I get done every 3 months and kind of see where I'm at. And then if there's anything that I find concerning, I usually bring it up to my nephrologist. Instead of waiting for him to say something about it, just because I know obviously I'm not his only patient, his world doesn't revolve around me. And so I know that I have to stay on top of it, and I am responsible for my own care. So at the end of the day, that is something that I take very seriously, and I wanted to be educated and know what the numbers meant, so that I would be able to have those more informative and better conversations with my nephrologist about my care and my treatment.
That's great advice, actually. One more topic that came up when we talked to the another person who has IgAN that I never even thought about, and I'm wondering if you considered also. So this woman didn't find out, she got her diagnosis, but didn't really know how serious it was until she got
Mhm.
pregnant and it affected
Oh.
her pregnancy. So I
Mhm.
was wondering if that was ever, and it turned out she had preeclampsia, which they think, is I guess they don't have enough information to know how IgA nephropathy could affect your pregnancy. But has that ever come up in any of your research or considerations about pregnancy and, the hormonal effects that could, be the outcome? So if you just talk to that a little bit.
So I know that IgAN is mainly the focus is the kidneys, but it really is kind of a systemic disease because of the autoimmune part. And so pregnancy changes everything. I've never experienced a pregnancy and I probably never will because of the treatment I'm on, but it is something that I did think about a lot. And I remember having that conversation with my nephrologist very early on, and especially when I started the treatment, because you're not supposed to get pregnant while you're taking it because it can cause birth defects and all kinds of things. And so we had that conversation, and he said, it could be safe, it might not, we don't really know, but you can't be pregnant on this treatment, so you would have to stop treatment, start something else, then try to get pregnant. And, that whole time during the pregnancy, and potentially during breastfeeding, your kidneys are taking a hit because you're not on the proper treatment that you're supposed to be on. And we're kind of just giving you something and hoping for the best. But ultimately, it's not the best thing that you should be doing. And so it's like you kind of have to really weigh that decision and think about how important is it to me to start a biological family, and experience a pregnancy. And for me, it just wasn't worth it. I think my own health comes first because personally, I don't see a point in experiencing a pregnancy just to die and then not being able to raise a child and leaving my partner alone to raise a child. So it was just like weighing my options and everything. I definitely quickly decided that that was not the route that I was going to take with my life. And I kind of already felt that way pre-diagnosis, so it wasn't too hard of a decision. But I definitely understand that it is very important to a lot of people. And I would just, you know, consider adoption, consider maybe surrogacy. There are other ways to start a family. It doesn't have to be, a pregnancy. So,
Well, also the fact that your doctor brought it up was very important, I think,
yeah.
because a lot of the other lady, her doctor never brought it up.
Yeah,
So, you have to consider, I know with my grandson, we're considering what's the effect of puberty, so
mhm,
there are all these different milestones in your life that may affect, like you said, it's systemic, it may affect your body. So you have to be aware to bring these things up to your doctor, not be afraid to bring it up.
absolutely.
So I think
Absolutely.
that's the really important thing.